This, if you haven't heard, a few months ago, the Edmonds Chamber was awarded a contract with Washington State L&I to serve as basically kind of an outpost, space to provide information to the local small business community regarding L&I information. So the chamber staff, we've all been trained and mostly kind of how to really navigate the L&I system, so we can help refer you to resources or connect you to appropriate people, and hopefully serve as a perhaps less intimidating space if you have questions about how you're running your business. So we are here as a resource, and we are excited to be that for you. Today, please silence your cell phones. Yep. And just so everyone knows, as part of our contract with L&I, we are going to be recording this session so that people who were not able to attend today are able to watch it later. So just keep that in mind if you don't want to be on the video. And we'll be having it kind of facing forward the whole time. So, without further ado, our two speakers today are both employees of Washington State Department of Labor and Industries. We have Mark Joseph, a safety consultant, and Chuck Durham, who supervises industrial hygienists, two folks that we thought would be particularly relevant to our small businesses.
Thank you, everyone. Thanks for having us. Before we get started, I just wanted to extend my condolences to the city of Edmonds and the police department, and to the family of the fallen officer. It's the third time this week that an officer in the Northwest has been killed. And so I'm a retired police officer, 32 years. So that's kind of a subject that's near and dear to my heart. So I just wanted to get that out.
Thank you for your service.
Thank you. Thank you. So I don't know how many of you are familiar with what L&I does. Free water. Thank you. So L&I is essentially the state's largest insurance company, right, for workers' compensation insurance. For your homeowner's insurance and your car insurance, you can get that pretty much anywhere. If you're a business and you have employees in the state, you have to have workers' compensation insurance, and you can only get that in one place at L&I. L&I does a lot of different things in addition to providing workers' compensation insurance. We're in the DOSH unit, the Division of Occupational Safety and Health, and we regulate and enforce safety laws in the workplace. And so within DOSH is compliance and consultation. So has anybody had a compliance inspection? In businesses that have had a compliance inspection?
Oh, no, not inspection.
You had a consultation. So
Where we asked for it?
no. So the compliance inspectors, they show up unannounced. I'm so-and-so, I'm a compliance officer here to do a workplace safety inspection. They would do an inspection, and if you have hazards, they cite you for those hazards, and some of those citations, those monetary penalties can be substantial. So on the other side is consultation. So we have to be invited out to the businesses. Employers want us to come out because we're going to get them in compliance. We're going to make sure they have everything they need. They have all the right programs. They're doing their training. Their equipment is safe. And by virtue of having a consultation, it exempts them from having a compliance inspection for a year unless something happens, such as an accident where an employee is hurt, or a complaint, or a referral from a customer. Complaints usually come from employees, and referrals usually come from customers, or sometimes just people driving by who see a hazard and report that to L&I. So absent any of those three factors, if you have a consultation, you wouldn't have a compliance inspection for at least a year. So what are the top 10 things? Are there any questions about L&I so far? Yes, ma'am.
How often do you do a consult?
You think, Chuck, like annually?
Well, you get one consultation visit per employer each year. We don't recommend that you have to put this on your calendar every year. and come out and do
For that
this.
protection.
Yeah, for that protection. The importance is if something changes in the workplace, you have equipment, or you grow, or you get smaller, things change, we can come out. Our priority would be for those employers with 25 employees or less, so small employers.
Okay.
Larger employers should have the money to hire consultants or safety professionals to help with safety.
So we want to talk about really the top 10 things that our compliance officers cite when they come out to do a compliance inspection. Number one, accident prevention program. So every employer is required to have the program. It's a formal, written accident prevention program. It can be as extensive as it needs to be to cover the tasks that the employees do, but it has to at least cover some basic items such as a safety orientation, a description of the total safety and health program that the employer has, on the job orientation showing the employees what they need to do to perform their job safely, how to and when to report on the job injuries, including instructions about the location of the first aid supplies in the workplace, how to report unsafe working conditions, use and care of the required personal protective equipment, what to do in the event of an emergency, how to exit the workplace and where to meet a collection point, and the safety meetings. Whether you have safety committee or safety meetings. And the other issue is the identification of hazard gases, chemicals, or materials on the job, safe use of them, and the emergency action that should be taken in the event of an accidental exposure. So that's probably the thing that's cited the most. Either employers don't have an accident prevention program, or it's not tailored to their specific industry and address the hazards that their employees face. So there's a general industry accident prevention program, and then there's a construction. Are you in construction, sir?
Yeah.
Okay. So do you have an accident prevention program for construction?
We do.
Okay. And we have a sample of one of ours if you need to see that. So
Sample trucking?
no, not trucking, sorry. So construction is a little bit different. There's some different requirements. And I wasn't going to talk too much about construction because I wasn't sure that there would be a construction representative here. So again, it has to be tailored to your specific industry. Okay. And then there's the general industry, there's construction. And the next thing is the globally harmonized system for hazard communication. Chuck, could you address that?
I don't know if I can pronounce it. The GHS program is, I don't know if
We
you.
have you.
Yeah, I was gonna say, that would be off camera, sorry. So you're talking about hazardous chemicals in the workplace. And the Global Harmonization Program is just a new harmonized safety and health program for hazardous chemicals, and it's worldwide. So they globalized it so that wherever you go in the United States or in the world, it's all the same. The symbols are the same, safety data sheets are the same. So you should be able to get your safety data sheet from a foreign country, and it should look just like one from the United States. So that's basically what the program is. And if you have chemicals in the workplace, you're required to have your safety data sheets and a written program to address to employees how you're going to manage safely those chemicals and protect them from the hazards of the chemicals. So that's pretty much it in a nutshell. One of the most cited things actually in our field, industrial hygiene.
And again, if you have those chemicals, you might be required to have an eye wash station.
Yes.
Right?
Yes, if you're using them.
The next thing is fall protection. That's one that gets the most employees hurt or killed. Fall protection is required when employees are working at 4 feet or higher. And it can be a range of different forms of protection from a guardrail to a fall arrest system or fall restraint system, depending on what they're doing and how high up they are. But fall protection is required when employees are working at 4 feet or higher. And so I did a consultation here about 2 weeks ago. On the second floor, they had like a balcony outside, and they had what's called a parapet. And so the wall was about 30 inches high, but that's not gonna protect an employee from falling over. So at minimum, the wall needs to be 39 inches high, plus or minus 3 inches, 39 to 42 inches, right? And then if it's a like a guardrail kind of system, then there needs to be the top rail and a mid rail. But that parapet is only 32 inches, I think. It needs to be 39, so they have to build that.
Can I ask a question?
Yes,
When you say 4 feet, are you talking feet, head, body,
4
where?
feet from the ground.
So if individuals' feet are 4 feet above the ground, like, does that include ladders or
No.
ramps or anything? Just like
No,
upper levels without
Right.
without guards? Thank you.
right, like a walking working surface, right? A ladder, fall protection is not required on a ladder unless you're at least 25 feet off the ground. Fall protection at 10 feet is a little different, primarily for construction. Like for roofing, roofers get a little bit more latitude because they're on roofs all day, every day. They're not required to wear fall protection until they're 10 feet or higher, or unless the roof is a steep pitch roof, then it would be 4 feet. But on a standard 412 pitch roof, roofers are required to have fall protection at 10 feet. And then working at 10 feet or more, whether you're a roofer or any other industry, if you're working at 10 feet or higher, not only do you have to have fall protection, but you have to have a fall protection work plan, which is a site-specific plan that addresses that job, that day, what's being done, what form of fall protection the employee will have, and what form of a rescue would you have in the event that the employee needs to be rescued.
Question?
Yes, ma'am.
So is this on site, or, because again, I am with the trucking company. And so are you saying if they're on a trailer that's 10 feet or higher, then they will require the fall protection and we will need a fall protection plan?
A fall protection work plan is required at 10 feet or higher, but on a trailer, like a
Well,
truck.
I was asking, is this plan for the terminal itself, or what if they're on the road? Does it just apply to at any time, any form of work, or just on their place of business?
Well, it's different for trucking, for transportation. That's called rolling stock, and they have different rules.
Wow.
So I don't think, from what you're describing, fall protection would not be required if you're in a rolling stock on a trailer.
Okay.
Okay.
Thank you.
Safety committees, safety meetings. So the rule on that is fewer than 11 employees, you're required to have monthly safety meetings. And in our website, we have a number of suggested meeting topics that you can have for safety meetings. If you have 11 or more employees, you're required to have a formal safety committee. The safety meetings have to be monthly, but if you have 11 or more employees and you have a safety committee, the committee itself can establish their own meeting schedule, but you need to have at a minimum of 1-to-1 ratio between employees and management. Okay. And these are the employee members of the committee have to be selected by their peers and not appointed by management. Okay. So safety committees or safety meetings, again, Safety committee can establish their own schedule, but they have to be, minutes have to be taken, and they have to be maintained. You have to indicate what safety topics you talked about that meeting, which employees were present, and you have to maintain those records. The next one is employer's responsibility, or what we call safe place. So that is really more of a catch-all statute where it doesn't specifically address any particular hazard, but as an employer, you're required to maintain a safe workplace for your employees. So that particular hazard has been cited for a number of different reasons. It's been cited for having torn carpet where employees can fall, because there's not a specific statute for having torn carpet. So that particular statute has been used for a variety of different hazards. But typically it's resulting from an injury where an employee got hurt. So again, employers are required to maintain a safe workplace for their employees. The next one is a industrial hygiene issue. Asbestos, yes, please. Asbestos. Turn away.
So I'm not going to explain to you all the different types of asbestos there is. But if you're going to remove asbestos in Washington State, you have to be a licensed contractor. And if you're a homeowner, you can do your own asbestos work. You don't need a survey as long as you're not renting out that property. But if you're going to, let's just say, remodel a duplex or an apartment building, and that building is older, or is, we'll say, it was built before 1980, it's likely to have asbestos in it. And you probably know that from contracting.
Yep.
As a contractor. So you're required then to presume that there's asbestos there and have a survey done. And then that's where usually people fail to have that work done, or they try to do it themselves to get by from hiring an asbestos contractor. So then they get hit by compliance for that reason as well. Do you have any questions about this? That's a whole subject matter in its own, and I didn't come prepared to talk about asbestos. But if you have any questions, we could talk over on the sidebar.
I do have a quick question. It's not, yes, so the question is whether that's an employer responsibility or a landlord responsibility.
It's an employer responsibility. So if you are renting a building and say from a landlord, if I'm the landlord and you come to me and say, I'd like to remodel the building where I'm living, but I'll give you permission to do that, but it's still the landlord's responsibility because he's the owner of the building to make sure that survey gets done before you tear into whatever remodel that you're going to do. Because it falls back on them. Because they'll probably hire some employees to help or do the remodel. If you're doing it yourself, you're still going to contact the landlord or homeowner and find out if the survey is done, because you want to protect your health, your family's health. You don't want to go cutting through sheetrock with popcorn ceiling in it and coming down on you, and then you could be exposed to asbestos when you start doing that type of work. So when in doubt, either call us, because this gets really tricky, as probably you already know. As asbestos, you can have a survey done and then accidentally get into asbestos through going through a wall, and you go, oh my gosh, there's some thermal insulation we didn't know about there, they didn't catch. And then you have to stop the work, and that has to be controlled, encapsulated, or left alone, or removed. So it's always best to call us.
The next item is personal protective equipment. So employers are required to do a hazard assessment for personal protective equipment to assess the tasks that the employees do and what personal protective equipment they might need to do those tasks. So they have to have a documented hazard assessment for personal protective equipment. Then that equipment needs to be maintained and inspected regularly and supplied by the employer, not forcing the employee to provide his or her own. But there has to be, yes, sir.
Is that something you all provide as a hazard assessment? Is that a service?
We have a form, a checklist.
Okay.
For if, when we're done, if I can get your email, I will email you
Yes.
a checklist that you can document your hazard assessment.
Okay.
So it's like a job hazard analysis. So you're looking at what tasks the employees do, what personal protective equipment they might need to do those tasks. Okay. And again, that's something that has to be a document that you maintain for the employee and the tasks that they are doing. And last on the list, probably the most frequent item that gets employees hurt is ladder use or improper ladder use, not training ladder use or not using the ladder properly, like an A-frame ladder, having it collapsed, leaning up against a wall to access a higher elevation. Can't do that. Or having a ladder just reaching the top of the landing that you're going to climb onto. Okay, it needs to be 3 feet above that. But a lot of times ladders are extended up just as high as they need to be to reach the top of the landing, and then the employee falls trying to climb back onto the ladder.
So putting a step ladder in a pickup truck to reach that hook on the lamppost.
That too. And so an improper use of ladders or not training your employees to use ladders, just assuming that they know how to use the ladder, you have to train your employees, and you have to document that training. So anything you wanted to add onto that?
In our industry, we have to deal with PPE on a weekly basis. Every house we go into to remodel is a different job location. It could have asbestos, it could have lead paint, it can have a variety of different things, and we need a fresh documentation, fresh safety hazard notebook for every job site. Ladder use, do we use step ladders or extension ladders? How do we tie them off to make them safe? How do we extend them to make them safe? Finding a way to get to that chandelier that's 15 feet up in a very narrow space can be tough. Scaffolding comes up, which has its own rules.
Right.
There are a lot of ways a human being can inventively climb up on a jungle gym, a stack of cans, all kinds of ways. And there have been ladders developed to work on stairways specifically.
Right.
The Little Giant is very recent compared to an old interlocking type.
Right.
There are ways that people do things. I myself used a sawhorse instead of a step ladder to do some painting, and it had a consequence. And I won't go into that, but I was doing something that seemed reasonable, but was dumb.
Are you
Just dumb.
Are you the employer contractor, or are you somebody's employee?
I am an employee.
Okay. All right. So
And because of that incident with the sawhorse, I was off duty long enough to look into safety.
So another issue we have with ladders is that people improperly position them. So they need to go out 1 foot for every 4 feet they go up.
Extension ladders.
Right, extension ladders, right. And so if you don't have the right ratio, then that ladder can collapse. And I saw a video just the other day of somebody falling off a ladder that way. It just fell. It fell in and they landed on their back and got seriously hurt. So I think you had a question, sir.
Yeah, so I'm a painting contractor, and so this is kind of a combination of what you're talking about, roof work and harnessing and ladders. So many times I may go out to a residential or commercial project where there's no, even though I believe it's code by roofing companies, there's no safety harnesses, straps or hooks installed.
Like anchors.
Anchors, yes. So is that a requirement isn't that code to, after a certain year, that those anchors should be installed?
Not that I'm aware
No.
of. No.
And my experience has been that roofing companies do not want to leave anchors on a structure because if somebody doesn't use it properly, the legal impact can come back to whoever installed it.
Right.
And they don't want to be
want
involved.
the
So they'll
liability,
put one in for their workers and then take it back out.
So the question on that is, as far as harnessing off on a rooftop, you mentioned a pitch and And the other question is, if I heard you correctly, 25 feet or above as far as on an extension ladder.
Mhm.
Is that correct?
Right, 25, above 25 feet, 25 or above, you have to have a fall protection work plan and fall protection.
Right.
Do you primarily work from a ladder or?
Exterior stuff, yeah, some lifts, but primarily extension ladders, some commercial stuff we use lifts and whatnot, so combination of boom lifts or just scissor lifts,
Okay.
which I know is another whole other thing in itself.
So scissor lifts don't require fall protection.
Right.
Unless they're specifically, unless the manufacturer of that particular lift requires it, but we don't.
Right.
Man lifts, articulated boom lifts.
Yeah.
Fall protection is required on those at any height.
Right, I understand that part of it. Yeah, there's some of the stuff I heard conflicting stuff as far as extension ladders. And some former employees have gone to work for bigger contractors and told me that they have to harness up on jobs at anything over 12 feet.
No. Okay. No. All right. So, but do you do some painting like how a residential while standing on a roof?
Yeah, you'd have to get up, dormers, different parts of that as part of that nature of construction or architecture. Yeah.
Right. So if you're not specifically doing roofing work, so which would require fall protection for a roofer at 10 feet, for painting, it's 4 feet. Right. So, yes, ma'am.
So going back to the PPE and the job hazard analysis. So I often create light duty for my employees injured on the job, and we want to make sure we take advantage of L&I's benefits. And so one of the jobs we have is assisting our facilities manager with doing facility work, including cleaning the showers, cleaning bathrooms, things like that. And somebody had mentioned that that they had to have special training to clean toilets based off of that they are being exposed to the potential hazardous waste. And
No.
I wasn't
No.
quite sure. I'd never heard of that. I mean, obviously we give them, gloves and masks and things like that while they're cleaning. But it was the fact that, we have to make sure that they're trained a certain way to scrub toilets and things of that nature. And I was just like, what?
No, but what chemical are they using to do that cleaning?
Oh, shoot, I don't know. Yeah, well, so like with gloves and masks not be
It would also be appropriate that you look at your material safety data sheet.
Just kidding.
Well, it's your best resource.
Right, okay, so
Because,
chemicals used for cleaning, and so use what was it, MSDS?
Look at your safety data sheet. Yes. What we used to call material safety data sheet. And that safety data sheet, you look under personal protection, and it'll tell you what to use.
Okay,
Gloves, eye protection.
right.
It may be surprising, but with a small business, you still have to have a safety data sheet for that canister of Comet cleaning, for the toilet bowl cleaner, for anything that if you drank it would be toxic,
Right.
anything that if you stuck your hand in it could leave you with burns or damage you. Those are the things that people usually don't think about, that as an employer, you still need to have that safety data sheet available that says not only what it is, but the way to protect yourself from it and how medically a person needs to be treated if they are exposed to it.
Right. Well, I know we have the MSDS book and all of that. I mean, I do the safety committee with our facilities manager. It was just when I was told that somebody was complaining about the light duty and that then the training was brought up and I was like, oh, wait a minute, I've never heard of that.
No, but do the folks use bleach?
I have no idea, but I will be vetting this if I can.
That would be part of your hazard assessment.
Okay.
Is to look at what
The hazard.
chemicals-
So
chemicals
you
are-
still recommend doing a job hazard analysis for light duty?
Yes,
Okay,
we call it a job hazard assessment. You can do a JHA job. That's where you're looking at the actual tasks for that job. And the assessment is, we're asking you to do this for personal protection, to make sure that your employees are protected from the hazards of that job. So it's a job hazard assessment, not an analysis
Oh, okay.
of the work assessment. Job hazard analysis is you're looking at a different, you're looking for the hazards, repetitive motion, types of work, I don't know, you have to
Yeah.
describe. it.
Tarping.
Tarping, things like
Shoulders.
that.
So, in addition to safety and industrial hygiene, when we go out to do, we do a lot of consultations together. Because there may be, both types of hazard, but we also have an ergonomist who can help you with repetitive type motion injuries. And those are all free services you get for the workers' comp premiums that you're paying for. And then we also have a risk manager that can help you manage your claims should you be having. So those are services that we offer. We love to help employers, and our cards are over on the table, and we hope that you invite us to come out and do a consultation. Yes, sir.
So I work for a business insurance brokerage, and what I've been told is a good medical plan or an accident plan can help businesses against the rise in premiums after a fall. So what I was curious about is how are premium increases calculated after a employee is hurt, and if there's anything I could be doing for my clients to help them with L&I claims and all that.
Well, it depends on what type of claim it is, whether time loss is involved. So time loss is the big one that will guarantee your rate to go up. So if there's an injury today that involves time loss, even if it's 1 day of time loss, in 3 years, that claim will hit the employer's account and will stay on for 3 years. And so their experience factor will go up. Say if it's 1.0 right now, by 3 years after the claim, it might go up to like 1.2. And so then the rates go up. It stays on that account for 3 years. And so a risk manager, depending on the severity of the injury, might recommend if the employee is only going to be off for a couple of weeks, and even a couple of weeks of time loss would increase the employer's rate. But a risk manager might recommend the employer keep that employee on full paid salary for that 2 weeks. That way, there's no time loss, and so then it doesn't impact the claim. And so just by virtue of having a claim doesn't increase the employer's workers' comp premiums unless it's a significant claim.
Because the thing is like he was saying, if you KOS for those 5 days and say it's $1,000 and they KOS for $1,000 and the claim cost is $2,000, there's a medical only discount, which means that claim will cost them $0 if you KOS. If it's time loss, that's out the door, you lose that discount.
Okay.
Did you have a question?
Yeah, and mine was regarding the risk class codes. How often do you update those, or should I be like evaluating that?
Well, you're assigned certain risk classes, right? And if you extend the duties of the employee, or you're hiring somebody who's doing something that is not addressed in that risk class, then you need to contact your account manager and have additional risk classes added. So
The account manager is the only one that can do that.
yeah, so yeah, the account manager is the only person that can add or take away a risk class. And if you don't know who your account manager is, let me know and I can look that up. Okay.
Do the account managers go to businesses and kind of do an assessment like you guys do? To assess the risk?
The account managers are in the tumble.
Well, no, I know, but
No.
I just didn't know if that was, I never thought about that.
It would be more of a telephone conversation. What are your plans to? And then they would assign
Right.
risk classes based on.
Are rates based on specific employers, or is it, I thought it was class, so like I own a catering company, so I fall into that caterer category.
Yeah.
So it's as a whole in the catering industry that rate is associated, not for my specific
It's-
business, correct?
It's the rate is based on the risk class, right? So if you're, let's say, you have a business and you have clerical staff, you might pay 14 cents an hour for every hour that clerical person works. But if you have a roofing company or,
Yeah.
you know, you're gonna probably pay $8 to $10 an hour for every
Yeah,
hour.
but I was thinking like the example of like, if there's a claim and there's time loss and things like that, it's again, the whole industry that the rate changes. It's not just my business as a as my personal catering company, or it is, if there's a claim on my account, my specific one does.
Right.
Oh, okay.
Unless you're in like a retro group. If you're in a retro group,
Got it.
then,
Then it's as a whole.
right, then there
Which I
could be
am.
hundreds of companies in that retro group, and then
Gotcha.
depending on how those 100 companies do at the end of the year,
Then that's
your rate could go up or it could go down.
But the EMR is still the same, that only impacts the refund. Your EMR is yours, so it still will impact your EMR. And eventually, all those claims do impact the risk class too, because if they have a huge influx of caterers getting injured, they're gonna look at that risk class and wow, this is more liability, it's gonna go up.
Yeah.
So we'll switch gears.
Okay.
We went to industrial hygiene. How many of you know what an industrial hygienist does?
Hearing loss.
Well, that's one thing. I was on a job site and the guy goes, well, I brushed my teeth this morning, and I'm going, well, good, you're a dental hygienist. You'll be happy. I'm an industrial hygienist and I don't do that. So I look at gases, fumes, things that can affect your health in the workplace, noise, and we go out and monitor for those hazards. So like you said, hearing protection is important with construction because of loud noise and equipment that they use. So if you have an environment with loud noise, we'll talk about that just for a second, you need to assess that environment to see whether or not that loud noise reaches the 85 decibel threshold or higher. And if it does, then you need to call us and we'll come out and do some noise sampling for you. And then determine whether or not you're going to need a hearing conservation program. But contracting and constructions is, I always just assume wear your hearing protection because you guys are going to be working with equipment and you're around other people with equipment, so the noise is always loud on the construction site. Unless you're just having lunch and sitting in your truck.
I worked for a computer center, a large bank computer center. And in 2 of their processing areas, the noise level was greater, 85.5 to 86 weighted dBi. And measured over 5 years, a visiting truck would come, the employees would go in, get tested. And when it was determined that we were that close, the bank said, it's just smart for us to develop a hearing protection program.
That's right. So evaluate your workplace for loud noise, and it could be anywhere from computers to construction to, I'm from Eastern Washington, apple packing. The packing sheds are noisy. You have all the clanging conveyors and the apples dropping in bins, and so you would be surprised at the noise levels that we reach over there. And the engine rooms, among the refrigeration rooms, are really noisy. So you had your hand up.
Yes, sir. I just want to ask about sustained noise, if there's an issue with sustained noise
Yes.
versus just intermediary.
Yeah, the sustained noise, it has a higher threshold.
Right.
Meaning what happens is you get to that threshold quicker because the noise is louder, so it doesn't take as long. Instead of 8 hours, it could take 2 hours or 1 hour to reach that threshold at 100 decibels or above.
Right. So let me ask a very specific question. If I put on a concert and it's at 100 decibels for that concert, what's my obligation for a 50-minute time period?
We'd have to come out and measure that. I wouldn't really be able to give you that figure right here.
I understand.
And because it varies, the distance you're away from the stage or from the equipment, there's just lots of variables there. But it's something we could do. It'd be an interesting console. We do gun ranges, firearms. So that would be an interesting one.
Thank
And I was gonna say that threshold is only for employees of
Yes, I was
that.
going to get to that.
What about volunteers of that organization?
Unless they're paid volunteers, then they're not covered by us. But there's some caveats here, so I don't want to say blanket that all volunteers are exempt. You need to call us to make sure so we can look up what you're doing and just kind of have some more questions, get a better idea, and then we can give you a more definitive answer. I don't know how, it seems like I'm rushing for time here, but if you, I don't know how long you're going to be here, but I got about 15 more minutes to go. Is that all right? Okay. I just want to transition a bit from what we've been talking about because I'm going to come at this in a different way. In your handout is in your packet there, there's a safety and health program assessment form. Because when we go out to work with employers, we come out to help. That's our job with the helping side of labor and industries and DOSH, Division of Occupational Safety and Health. Compliance guys, they fine you, we don't write citations and penalties. But the main thing that I wanted you to get from this talk today was in your packet, you're going to see a form, what we call the Form 16. And that's, I know I took one because I gave you one. Find that. It looks like this. And for the viewers, I don't know if they're going to be able to see this, but this is one of the most important forms I think you should have in your toolbox for your company. You have an accident prevention program. That's great. I mean, as you heard from Mark, it's the most cited hazard in workplaces that we find. And when we go out to workplaces, it's still not unusual to see employees without a hazard assessment, without an accident prevention program, and then many compliance visits as a result of that because they're not really managing their safety and health program. So what we try to do is go out and work with that employer to build an accident prevention program with them. And then I give them this Form 16 is because this evaluation tool I think is important for anybody that has employees and is running a business. This is a self-evaluation tool that I wanted you to have so you can take back to your work site because we don't know where you're from, but you should be able to use these 4 core elements to evaluate your workplace and determine whether or not you're providing a good, safe, and healthy workplace. This is a 2-hour presentation condensed into 15 minutes in a worksheet. So I'm hoping you get some value out of this, but I'd like to go through it with you because it's so important to me. And Marcus uses it in his consultation visits as well. And so when we're all done with the consultation visit, we give you a written report. And we always include this information in the report because this tool we use as we evaluate your workplace when we're walking through it. We're looking for hazards, but we're looking at how well are you maintaining your safety and health policies and procedures. And this is one tool you can use to evaluate yourself to whether or not you are. Okay, so let's go through it. The first thing you're going to see is management, leadership, employee involvement. So this core element is so important because if management isn't involved in safety and health, you don't have safety and health in your facility. Because if the owners, the managers aren't walking around and investing their time and looking for hazards in your workplace, working with employees together to evaluate that workplace, to do the hazard assessment that Mark talked about, then you don't know what hazards are in that workplace or what you're being exposed to. And therefore, those hazards are there and people are going to stumble into them. They're going to get hurt. They're going to use a piece of equipment that they haven't been trained on, or they're going to get something in their eye, face, and hand, or even they're going to do a repetitive motion over and over and get a shoulder, hand, arm syndrome. And those are hazards that could be inherent to your type of industry that you need to know about. So managers, owners, and folks need to walk their workplaces to see where those hazards are. Because you'll be surprised. So we'll come in and we'll go, well, there's a hazard, there's a hazard. And the guy goes, supervisor might walk right by that and not even know it's a hazard. And we point it out to them and they go, oh yeah, I can see that. Well, it's kind of a shame that you operate this industry or this business and you don't know the inherent hazards of your industry. I think that in my mind, I'm going, how could you do this and not know that? You know, because we don't even know your business and we're walking in and finding these hazards. So management needs to be involved. So if your managers aren't involved, get them involved. You know, take them or ask them to get involved with the safety committee and go do a walk around of your facility or your office or wherever you work and look for hazards, things that can hurt you. Ask employees for input because they're going to tell you where the hazards are. Oh yeah, you know, it's leaning against that table when I have to do this reaching, I get this pain right across here. Well, there's a hazard. It may not be a code hazard. What if you just pad that? So when they lean against it, it's soft, you know, and there's no pressure against their abdomen. It could cause a hazard or cause an injury. So little things like that are important. So make sure that you're walking through doing hazard assessments and then answer this, yes or no, or does that need improvement? So if you're doing that, great. Then you should have a list of hazards and we'll have in that list of hazards, you could show us when we come out, here's some of the hazards that we found in our workplace. And we could go through those with you to make sure that, yeah, those are real hazards. And we'll probably add a few more there as we finish this walk around. But that shows us that employers managing their work site because they're invested in looking for hazards to keep employees safe. That's your duty as an employer. Safe and healthy workplaces. It's mandated by law. And when people don't follow the law, they get cited by compliance. So the next one is number 2. Does your manager, owner, operator, do they support safety and health? That's a big issue. They may talk the talk, but they don't walk the walk. So try to get them invested, pull them into what you're doing and educate them, train them. You'd be surprised that a lot of owners don't know what's going on outside of their office door or on the floor. They really don't. So it's up to the employees, supervisors, people in charge to educate them and get them out there. Many times they come from the floor and they have a good understanding, but a lot of times they don't. So take the time to educate your employer. And the employees, when they get involved, what does that look like? Having employees involved. It's you looking for hazards. I have a hazard in my workstation, so when I train Mark, I'm going to train him about that hazard there that I found. So as employees, you're training each other, and you're also getting training from your employer. But what is the most important thing you should be doing? Writing that hazard down and giving it to the employer or the safety committee so that they can correct it, and then they know about it. If you don't do that, that hazard's going to remain there, and someone's going to get hurt, or their hearing is going to go, or they're going to miss it, get a nip or a amputation or a crushing injury or something, whatever piece of equipment that they're using can cause that. So employees need to participate, number 4 there, in hazard identification, prevention, and then control. If you have the authority, fix it. Don't leave it for someone else because they'll get hurt. So it's very important.
But isn't that what the safety committee is about? Because when I was creating the safety committee, I went to my peers and Troy, and I asked them, how do you do this? And one of the things that I heard was that it basically were, yes, management and lay people, but safety director is to stay out of the safety committee because we're supposed to be identifying and helping them and then presenting these findings to the safety director to then address.
Yes, your safety director should be involved in your safety committee.
Okay, so he should be involved? Okay.
If he's the one that's going to make the changes or fix the hazard, he needs to be involved. If my worksheet goes to him and he corrects it, then he needs to be involved, or she, whoever that is. It's a very important job to be the safety director. They should know the hazards that are inherent to that workplace. They should know. That's their job.
Well, yeah, I thought they were doing it outside of us, and like I said, we were just kind of,
You should be a team.
okay,
Work together.
okay.
The next item, the second core element is number 2 there, and that is that worksite analysis. So managers and employees, everybody needs to be in that involved with the worksite analysis because again, we're looking for hazards. And what do I mean by a worksite analysis or a hazard assessment? So if you have a job that, let's just say we had a press here, and each day we put the part in, we push the foot treadle, the press comes down and stamps that, and so that machine has to be guarded. And also we will look at how that operates to see if there's any hazards. Has that been bypassed, the foot treadle? Has the guard been removed? So you're looking for hazards associated with that job. And when you find them, you write them down and present them to the safety committee of the director. That person. So you do that with every job. Okay, so if you have 10 jobs, you evaluate all 10 for hazards. When you find a hazard, you find out who has responsibility to correct that hazard. You might be able to do that, but you also want to make management aware that you did correct it. Okay. So the safety self-inspection is very important, and it's not just your safety director's responsibility to do that hazard assessment, do that safety walk-around. Everybody should be doing that within their job and within the facility or wherever you work. Okay, I heard that there might be hairstylists or people here. So what are the inherent hazards with hairstyling? Shoulder injuries, hand injuries, repetitive motion injuries, back injuries. So those are things that you're probably already aware of. You probably were in the trade and not have your own shop.
Not in the trade, but certainly observe it.
Chemicals involved. So a hazard assessment is important because I want to be able to protect my employees from using the chemicals And I want them to know that there's adjustable chairs may be available, that we can look into ergonomics to make that job easier. We could use larger handles potentially for our equipment. So there's all kinds of tools out there that can make that job easier. But you still need to do a hazard assessment and find out what types of hazards are there. There could be slip trips hazards, cords, mats, things like that. Back injuries from lifting and bending. So those are areas that we could look at. And then again, document those. And is there a process in place for investigating accidents? That's really important. Mark does, well, we were both compliance officers, but safety did more hazard investigations than industrial hygienists because not many people die in industrial hygiene unless it's chemical exposure or something like that. But in industry, there's a lot of fatalities. In fact, in Washington State in 2021, we had 53 fatalities in Washington State, which is down, thank goodness. But there are, when we talk about ergonomic claims, workplace WSMDs, in Washington State, I believe it's in the millions. I wrote it down actually. We spent in, I didn't have anything for the last year, but say from 2000 to 2013, $85 billion in Washington State for ergonomic hazards. 43% of the claims in Washington State are ergonomic claims. So it's a big, we pay out a lot of money for those types of claims. So in your walkarounds and your hazard assessments, look for ergonomic injuries, construction especially, slip strips, falls, back injuries, lifting, carrying, pushing, pulling, all those are ergonomic, can cause ergonomic injuries. So number 3 there is hazard prevention and control. So when you find a hazard, it's up to you to bring it to management's attention so they can control it or prevent it, change equipment, put the guard back on, whatever it is. Ordering a different chair if you're a hairstylist that sits down, or an office worker, an ergonomic desk, an elevated monitor, keyboards, sit-stand workstations. All of those are important to evaluate because if that employee continues to work in that environment, what usually happens is an ergonomic injury, a back injury from sitting too long, and they could have been standing occasionally, or repetitive motion carpal tunnel from the keyboard. So those types of hazards are important to identify and then train folks on how to prevent those hazards and what equipment's available.
I just want to let you know that it is 1 o'clock, so
Okay.
we've got 1 or 2 more
Can I
minutes.
wrap it up?
If anybody needs to.
Okay, and then lastly, I'll just cover safety and health training is the last one. So I hope this tool is valuable for you. You can take it back to your workplace. Evaluate yourself, I'd say quarterly, annually at a minimum to see if you're actually fulfilling these core elements. If you could say yes to all of them, that's great. And you're doing a good job in safety and health. But most people will, if they're honest, will find a few gaps there and you want to work on that. And training is so important because a lot of times, and we were talking about claims here, you hire someone within the first 2 weeks, if they're not monitored, they can injure themselves without good on-the-job training and monitoring. It's I forget the statistic on it, but within 2 weeks, a lot of new hires injure themselves because they lack of good training or proper training when they were first hired. So that involves an orientation to the job, no matter what type of work you're doing. Usually lasts a day or 2 to come into the business. With us, the type of work that we do, our orientation goes on for like a year because for safety and health, codes are always changing. So we're always in training and we're always getting new information. And you look at our website, you can see how the codes change, the laws change, and you guys have a tough job to stay up with all of that because we do too because of all the changes that come out through legislation, just through promulgation of different rules and things. Thank you. I hope this was helpful for you.
Mark and Chuck, both so much for taking the time to be with us, answering questions. If there are remaining questions, either from the content that was covered today or just other questions you have about L&I, You're welcome to write some down right now. If you don't need to jet out the door, there's some notepads in your folders. You can always write something down, tear off a slip and leave it with us, and that will help us plan for future workshop and information sharing. You're also welcome to email us anytime at the chamber with any questions about L&I. And if we don't have the answers readily available, we can figure out how to get you those answers. So please use that as a resource and let other folks know, any other employers you know in your circles, let them know that we're a resource as well and want to help out. So thank you guys for taking the time to be here today.
Hey, I did bring some sample template things if you're.
Business cards are on the table. If you'd like to call
Yeah.
us for a consultation.
Mark and Chuck's business cards are there. Our business cards are also on the end of the table, so yourselves to meet on your way out. And if you didn't get a treat yet, please grab a treat from Chef Day and Catering. Thank you, Carol Ann.
Want to mention that, but we